It is supposed to be the great leveller, infecting porter and Prime Minister alike. But are some more likely than others to die from this disease? These are the faces of dozens of health workers who've given their lives as they cared for others. We may not know exact numbers, but their pictures alone tell a story. It's startling to see just how many were from black, Asian and minority ethnic backgrounds. And today, in a letter to all hospital trusts, NHS England has confirmed what many have feared.
Emerging UK and international data suggest that people from black, Asian and minority ethnic backgrounds are also being disproportionately affected by COVID-19. Public Health England have been asked by the Department of Health and Social Care to investigate this. In advance of their report and guidance, on a precautionary basis, we recommend employers should risk assess staff at potentially greater risk and make appropriate arrangements accordingly.
Why is it that so many people from BAME communities are dying? Issues around the use of PPE or lack of use of PPE. And what's quite clear that the COVID-19 is actually a reflection of the inequalities, structural racism and public health inequalities in society.
What do the statistics show? Well, there are gaps in the data, so it's quite tricky. What we do know from NHS England figures is that of those who have died in hospitals, 18% have been from a black and minority ethnic background, but they only account for 14% of the population, so there is an elevated risk. But these figures are only from hospital deaths. We don't know what's going on out there in the community. We know that some BAME communities are more likely to live in areas of deprivation, in multi-generational households, often in big cities where there have been more cases and where social distancing can be more difficult.
But the problem is that we don't have data that's been analysed.
Such as geography?
Absolutely. So there's geography, there's socioeconomics, there are cultural issues which you can't get from routine data. But the most important aspects we've seen is people having other chronic conditions. And the chronic conditions are diabetes, cardiovascular disease, and high blood pressure, hypertension.
The government has already ordered a review into why people of a BAME background seem to be disproportionately affected by COVID. But its credibility has already been questioned after it emerged that Trevor Phillips was linked to it. Mr Phillips was recently suspended from the Labour Party after allegations of Islamophobia. Channel 4 News understands he's not leading the review, as has been reported, but is contributing to it.
I don't know who made the final decision about his involvement, but I think it would have been useful and to listen for all of us to learn that maybe the government should talk to people before making a decision.
Until that review is published, NHS England has tonight advised all hospital trusts to risk assess their staff and to make appropriate arrangements to protect them.
The Home Secretary is to grant free visa extensions across the health and care sectors. Priti Patel told the Home Affairs Select Committee her department is looking to extend workers' visas as well as lifting health surcharges, although she said that tracking cases in the care sector is very challenging. But some campaign organisations say it doesn't go far enough and doesn't include, for example, spouse or family visas, as our senior Home Affairs correspondent Simon Israel reports.
Mental health nurse Jackie Borden is having her first baby, but her husband, Ayub, is very unlikely to be there when it happens. Coronavirus has splintered their joy. He's still in Morocco in the process of applying for a spouse visa, while she is waiting here. But everything's now on hold. Information from the Home Office is hard to come by about what exactly will happen to his application. Emails costing her £5.43 a time went unanswered. Phone calls at £1.37 per minute go to voicemail. Living with not knowing is not easy.
There's so many unknowns, so you spend every day what-ifing in your mind. What might happen, what will happen, and the answer is really just no one knows.
So the prospect is you may have to have the baby on your own?
Yes.
Without the father being there?
Yes.
Harriet Paynton is living with similar uncertainties. At least her husband is here. He's Syrian on a spouse visa, but it needs renewing. The cost is £3,000. He's had jobs, but they're not there anymore. The couple must meet certain financial requirements. She's a student nurse. Their income is limited. Again, No help, they say, from the Home Office on any possibility of a pause.
Nobody in this situation is a burden on the state at all. They can't be, because they have no recourse to public funds. We can't access benefits. I don't know how many people are in this situation, but it will be a huge number. And I think the Home Office has to realise that we're trapped by this situation. There's nothing we can do.
They are just two examples out of many of what COVID-19 has done to the visa system, to those here or those trying to get here. Last week, the Home Affairs Select Committee said they were very troubled upon hearing of countless cases where people felt simply marooned in their futures. Today, the Home Secretary revealed to the Home Affairs Select Committee further concessions on visa fees and deadlines for those on the front line, but admitted casework was challenging.
I must emphasise, though, with social care, we are subject to some difficulties here in terms of understanding and knowing the immigration background and status of individuals, and particularly those that have not come through the Tier 2 route in particular. But I do want to say, even with the immigration surcharge, the health surcharge in particular, that is money that goes to the NHS directly. You'll be aware of that. I've been very clear. We are looking at everything in terms of reviewing positions and policies throughout this COVID crisis.
The committee were armed with a long list of troubled citizens, not all on the front line, whose partners and families are struggling in the COVID-19 world.
My husband is furloughed. His spouse visa runs out in August. We don't have funds to pay for another.
I'm worried we will not have the visa application fees in time.
We remain fearing for the future of our family unit.
We've sent the Home Office very clear indication of what needs to be done to help those under a family visa. And that wasn't highlighted at all in that conversation, which is slightly concerning, to say the very least.
The Home Office said tonight, we continue to monitor the situation closely and, where necessary and appropriate, may make further adjustments so that people are not unduly affected by circumstances beyond their control.